तो इसमें अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
अरे इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Good morning, Apollo family. Do you want top tips to beat acidity? Do you want to know the reasons for the heartburn, acid reflux? Let's talk about GERD today in Apollo 24/7's Health Hour. We have invited Apollo's expert, senior consultant, liver transplant, hepatology and gastroenterology, multi-award winning Dr. Hitendra K Garg to today's live session. He is going to give us tips to manage acidity and acid reflux. Join us 11 a.m. today in the live session and ask all the questions that you wanted to ask. See you there.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour, a show which brings you confidence, a show which brings you answers, a show which brings you experts from Apollo Hospitals to your doorstep every week after week, Right from the pandemic, we've been bringing you Apollo experts, and today we are going to talk about a topic which concerns everybody, most of us. We are going to talk about top tips to beat acidity, acid reflux, bloating, belching. You want to talk about GERD? We are bringing you an expert from Apollo Hospitals, Dr. Hitendra K Garg. He's going to join us very shortly. So get ready with your questions. In this live show, you can ask your questions on the YouTube only. You must be watching it on multiple other platforms. But if you want your query to be answered, please go ahead, type your query on YouTube itself. And I urge you all to download Apollo 24/7 app because it brings you multiple other benefits while bringing entire Apollo hospitals to your palm. But it also gives you a chance of winning certain gift coupons if you participate in our show. You can avail these gift coupons and use them on Apollo 24/7. So Health Quiz also is going to come up on this show. Keep watching us and keep typing your questions and questions in YouTube only. All right, before Doctor joins us, let me also introduce you to this wonderful initiative which is being run by Apollo Foundation and Apollo 24/7. The initiative is called Saving a Child's Health Initiative, which is free pediatric consults for every child in need. SACHI in short. This wonderful program is in association with Apollo 24/7 is on a mission to make quality healthcare accessible to underprivileged children at no cost. Yes, you heard it right. This is benefiting children across India. 10 plus pediatric specialties who are renowned Apollo pediatricians are participating in this program. If you want to know more about it and spread the good word, please scan the QR code which is on the screen and do the needful to a child who is in need of this wonderful initiative. All right, let's talk about our topic of the day. Acidity with food, without food, or any other reason. Most of us have experienced it at least once in our lifetime. So let's talk about it, how to beat acidity. Let me welcome our expert today, Dr. Hitendra K Garg, Senior Consultant Gastroenterology, Therapeutic Endoscopy and Transplant Hepatology from Indraprastha Apollo Hospitals, New Delhi. Out of his 14 years of experience, he is experienced with Apollo Hospitals from last 9 years. His professional memberships have been, 6 weeks of interventional EUS fellowship in Mumbai, then hands-on fellowship in Montreal, Canada under Professor Anand Sahai. His specializations are working as a transplant hepatologist, therapeutic endoscopy, including endosonography, and a lot of achievements. He is awarded gold medals while in university, IAP Quiz Award in 1999, Best Posted Award, Indian Society of Gastroenterology, Bangalore in 2007. A lot of bursaries have been convened on him. Young Investigator Bursary Award in EASL Milan, Young Investigator Bursary Award Kolkata, Beijing, Thailand and Barcelona. He's presented various national and international papers and research papers, including American Association for the Study of the Liver Disease, AASLD, in the annual meeting of AASLD. It is our pleasure and honor inviting Dr. Hitendra K Garg. Good morning, Doctor. Welcome to the show.
Good morning. Thank you, Apollo 247 and Ms. Jhansi for inviting me to be here.
It's our pleasure on Sunday morning to have you here, Doctor.
Yeah, it's definitely, yes, it's a pleasure for me also. Just to
Great.
answer the audience query, or just to tell about, just to make awareness about what food habits are important for this acidity or the reflux.
Yes, doctor. So, as I was introducing, every human being, I think, understands that there's something going on in their system after food, before food. Not once, even a baby to an elderly person must have experienced some kind of symptom with acidity or acid reflux. So, what is the body trying to tell us, and when is it that it has gone beyond our regular thing? Is it regular for a body to go through this?
Yeah, if we talk about, today we are talking about the reflux. The reflux is, it's a gastroesophageal reflux. It's a normal thing. It's a normal physiological process. Once we
Yes,
eat it, that's receptors of the stomach is activated, and then distend the stomach so that the transient lower esophageal sphincter relaxes, and you feel there's a reflux. It happens. It's a normal process. It's a normal physiological process. It happens once or twice a week. But once there is a abnormal acid production, abnormal acid exposure of stomach into the esophagus, which leads to the symptoms like there's a heartburn, there's a common symptoms, the heartburn, there's a reflux, there's a regurgitation, you feel there's a problem in taking food, dysphagia, you sometimes you feel there's a sore throat, pharyngitis, sometimes there's a erosion of the tooth. So these are the symptoms there's a which you should aware, and one should consult your doctor. This is a time once or twice a week, it's a normal process, you can ignore that.
All right. So while we are talking, I see that there is a lot of participation on YouTube today. I thank all the viewers who have joined, and there's so much enthusiasm that I see that people have already poured in questions. So may I request the audience, quick request, to condense your questions into one chat so that it will be easy for me to place your query before doctor, and also kindly understand that there are more than 450 questions there on the YouTube chat. I will not be able to answer ask all of them. I will collect all the questions and place before Dr. Hitendra. I hope that's okay with audience and the doctor as well. And a small request to the audience again, not to please bombard your same question again and again. Leave your question once there. I will go through your question. Thank you. So, doctor, quickly, can you please explain what GERD, the gastroesophageal reflux disease, is?
Same, I just been talking about GERD. GER is a normal physiological process. It's a gastroesophageal reflux. It's a normal one. People can have one or twice a week. But once it is more than twice a week, or it happens because of the reflux of the gastric content in the esophagus, that is a food pipe, and this food pipe is not resistant to acid, which causes the symptoms. And the commonest symptoms you can have is the retroesternal burning sensation, you can call it the heartburn. Secondly, you can have the regurgitation, soreness in the mouth, or you can have a problem in fooding, there's a dysphagia, there's sometimes you feel there's a difficulty in passing food through the food pipe into the stomach. So these are the commonest symptoms you can have it. And the other symptoms you can also have, there's a sore throat, sometimes you have a bronchial asthma, there's a recurrent pneumonitis. These are the other symptoms which you can have with the gastroesophageal reflux disease. So these are, once you have a symptoms more than twice, must consult a doctor.
Yes. So, doctor, what can be the cause of this? What can cause GERD?
There's a once important is the food habit. If you do smoking, this what it does is it relaxes the lower esophageal sphincter. There's a sphincter. Once we take a food, there's a sphincter in the lower part of the esophagus between the stomach and the esophagus. Once you take the food, it goes within seconds to the stomach, and this the lower esophageal sphincter is closes down. So the acid production, which help in digestion of the food, which it doesn't come up into the esophagus. So once it relaxes, causes the hiatus hernia. When the part of the stomach comes into the esophagus and the chest, so the acid which produced in the stomach, which comes into the esophagus and causes the symptoms. So hiatus hernia is very important. Smoking, alcohol. If we do take a tobacco contains a nicotine. It's the same thing which is having the smoking. So nicotine is relaxing the lower esophageal sphincter. Again, there's a food habits. If we take a carbonated drinks, lot of spicy foods, and if we take a lot big food at once go, if you take a big bolus food, which is more than your stomach capacity, it come up and it causes the regurgitation. If you are obese, definitely it causes. There's a stress also. There's certain drugs like if you take a painkillers for many other reasons, like most common reasons in the pain in the knees for the older population. So these are the risk factors. These can cause the reflux or abnormal acid reflux into the esophagus, which can cause the symptoms.
Right. So while you're answering this, I just found Chakradhar Guntamadgu's question. I'm a patient of GERD after antibiotics and diarrhea tablets. So is this also one of the cause, doctor?
Yeah, antibiotic is called as the pill esophagitis. If you take it empty stomach, definitely it will cause. Antibiotic you should not take it over the counter. You should not do your own treatment. Once it should be consulted with a proper, a doctor, proper physician, and if he advises you antibiotic, you take it, but never take an antibiotic on the empty stomach. And another drug which he was taking is the
Antidiarrheal.
antidiarrheal. Why he's taking antidiarrheal medicine? Usually you take it once you have a diarrhea. It's not on a permanent basis. I don't know why you are taking this antidiarrheal medicines for a
But
long
do
time.
they
For a long
also
time.
cause GERD? Are there
No,
for any
no,
other reason?
antidiarrheal drugs usually do not. They act on a lower part of our intestine, loperamide or ridotil. So usually they don't cause any reflux.
Right. So, a lot of people are asking about GERD. And while I'm looking at hyperacidity questions, Rahul Jain, Soumya Mavesh, Sanjay Tiwari, Rajiv Pandey, all of these are asking, they're suffering from hyperacidity. They're asking for tips or how to manage hyperacidity. And Sanjay Tiwari is also asking about what can I do to do immediate relief?
So immediate relief, definitely. If you are at home, you are not with a doctor, you are not consulted a doctor. If you're at home and you are having acidity or a reflux or a chest pain, you can take a lot of water with the cold water. Cold water gives you a soothing effect. So, or you can chew the chewing gum also. That will, what it will cause, it produce a lot of saliva. It will dilute the acid, so that it will dilute the acid and will decreases the effect of acid on the esophageal mucosa. So you can have a chewing gum, you can take a cold water, so, or maybe crushed ice. So you can go it dilute the acid and it gives a soothing effect also. So it relaxes your your symptoms. It decreases your symptoms. You can have a ginger tea also. Not hot. It should not be hot, because hot can irritate the esophageal mucosa. So it should not be hot. You can take the ginger tea as well.
All right. So while you're answering this, how can I avoid antacids? Samya is also asking this question. Now most
So
of us reach out to these antacids which are over the counter and advertised so much so that कि हमारे दिमाग में अगर गैस आता है या बर्प आता है, बेल्च आता है, immediately brand याद आ जाता है. इतना we have announced, advertised and awareness वहाँ create किया है, but right food habits पे नहीं किया है हमने.
yeah,
So
agree.
what do you suggest and what is your opinion on over the
Definitely,
counter?
whenever we talk about reflux and its treatment, first and foremost is the lifestyle modification, and it is the important one, because if if you have a hiatus hernia, which is associated around 70-80% of the patients of the reflux. So the hiatus hernia means your part of your stomach, upper stomach, comes up into the chest, and it is because of there is a weakening of the lower esophageal sphincter. So once it happens, you can't tighten it up with the drugs. So if you go on a drug, you have to be for a long period, until and unless you'll not go to a lifestyle modification. It should be very important, because you can't keep on taking the most common
Medication.
drug is the pantoprazole or rabiprazole or omeprazole. So these are the over the counter drugs and most commonly available, and you can't have it for a lifelong. So first and foremost, we are stretching upon the lifestyle modification. What is lifestyle modification? What are the factors? The you must stop that there's certain do's and certain don'ts. Don'ts I will stretch in more important, because they if you do smoking is lot of harm. It relaxes already your stomach, lower esophageal sphincter is relaxed. If you keep on doing smoking, then definitely, yeah, it
Going
will
to be
increase your
advanced
reflux, it
further.
will increase your complication. You must stop smoking, must stop alcohol intake, must stop tobacco. So these three things you must do. The food habits, first, the I told you about, you should not gulp a food. I mean, you don't go in a bolus food. We used to take normally morning, lunch and the dinner. These three we used to take a large part of a meal.
There
So
are large meals in the day.
one should avoid a large meal in a day. So you should divide small frequent meal. So small frequent meal, you should take a small frequent meal. If you are obese, because once you are obese, what you'll do, you wear a pants and you take it. You use a belt for tighten up
Correct.
your you tighten up your pants. So what it do is increases the intra-abdominal pressure. It increases the pressure on the stomach and increases the reflux. So avoid the obesity. Try to do exercise, try to reduce your obesity, keep your BMI less than 20 to 24, so that your BMI is should be matched with your height or weight. And it's a rough formula. If your suppose if your is weight is everybody can't calculate the BMI. It's a because it's a computer based. So what is the simple formula? If your height is 170 centimeter, your weight roughly should be 70 kg minus 100 into your height. It should be your ideal body weight. So keep your body weight around should what is the ideal one. And obesity, cut your smoking, alcohol, tobacco. The food habits I told you about, you have to be divide your diet. You should avoid the carbonated drinks. You should not take the carbonated drinks. And certain spicy food one should avoid. Stress, because sometimes these have to be reflux is associated with the stress also. Stress, you go on smoking. So these are related. Try to do some if you can do meditation or keep yourself calm. So these are the things. Do physical exercise, regular exercise. So these are the thing, and avoid the painkillers. So these are the
Great.
things which
So,
lifestyle
yes, Doctor,
modification.
while you're talking about food, while you're talking also about food, I just want to note Jahan's question. So, are there wrong combination or wrong times of food that have to be avoided while you're talking about lifestyle habits and food habits, maybe
Long
wrong
time
combination?
food. This is again related to uh, because the acid production happens twice, once in the morning, early in the morning, 5 or 6 o'clock, and seven in the second in the evening. The morning, the surge is bigger than the evening surge. So if we talk about the time, definitely it should be should not be very late, because it the acid which requires it is not a abnormal thing. Acid production is not a abnormal thing. It help in digestion. So it should be on time. It is because time is once it help in a digestion. So it should be on a time. Morning, afternoon, and meal should not be delay at 2 o'clock or 3 o'clock. If you do it, then what it will do, you keep a diet and a sleep interval at least 90 minutes. At least 90 minutes. Those who are having a symptoms, because if you eat it and then you go on a sleep, become flat, and then the reflux will come up and you have a symptoms. So definitely on a
Right.
time, it's important. And what
And
very important,
combinations? Any wrong
combination of very
combinations?
spicy food, definitely one should avoid. Combination is very important. I want to stretch it on. This is water is what it's a somebody says. There's a myth about it. If you take a water during the food, what it will do, it will dilute your acid and it will decrease your digestion. It is not. If you take a water during the meal and one glass of water after the meal, it will help in your digestion, because it will disintegrate your food into disintegration means, if you take a bolus food, it disintegrate in the stomach. It will help in the disintegration, also it will help in the digestion. So if you take a water during one glass of water, I'm not taking about too much of a water. So
Right.
one glass of water during the meal and one glass after the meal, it will help in your digestion.
Right. So also when you're talking, you were saying sleep का pattern and food का pattern भी manage करना चाहिए, timing and cycles भी maintain करने चाहिए. Here are two questions that I spotted. Chris Maganti and Japamala, both of them are asking that they have extreme reflux in the middle of the night. Japamala says midnight she wakes up, and Chris also says that his reflux is more in the night. Why is it so?
It is happening in patients of hiatus hernia, where there's a These are typical symptoms. This is a typical symptoms of patient gets up because the acid will come up, and it will come up, and it goes into our chest through the our trachea into the chest. We'll have a cough, we'll have a choking sensation, or we'll have a sour mouth. I mean, there's a
Yes,
because
खट्टा
acid
दकार बोलते हैं ना.
so it is happening middle of the night, because uh, once you lie down, I mean, we take a food, and whatever time you lie down, the acid will produce because of it, help in the digestion. It is a normal process, so the food will stimulate the acid production, and once you lie down, it slowly this acid will come up, and you will have it. So these, once you take it in a normal individual, like those who are not having this hiatus hernia, this our lower esophageal will sphincter it tighten up, so the acid will not come up, and you will not have the symptoms of nocturnal awakening of having a cough, choking sensation. This is happening. I mean, it's a typical symptoms of hiatus hernia.
Done. So now I would want to point out to three important factors of. One is Anand Mukesh and Devesh Agarwal. Both of us are talking about gas. Devesh says, I'm usually suffering from gas, then stomach pain, bloating, and huge gas problem, Anand Mukesh. So, what is this difference between the belch burp and the gas that these people are talking about?
Ma'am, gas is definitely is a vague term. Many of the patient, they have a, I mean, they describe their symptoms in a different words. So production of gas is like, I would take it as there's a fullness of the upper abdomen. There's a reflux. There's a burning sensation, or there is a regurgitation. So this is the common symptoms. Many individuals, many patients, they take it as production of gas. Production of gas is like including of all these mixture of all these symptoms, like bloating. Bloating, it happens once if you take a take a lot of food in one go. So you'll feel bloating, production of gas, and it happens because gas production mostly happen because of the carbohydrates in our body. If you start taking lot of carbs, you start passing a increased production of gas because of its metabolism, and you start producing a gas. You fart a lot. So these, if somebody takes a lot of carbs, so in a treatment of these bloating, it's there's a treatment option is less than 20 grams carbs in a day. So this is carbs, if you take a lot of carbs, you have a lot of production of gas. So bloating can have because of the lot of increase in the carbohydrates.
Right. So it's about, again, coming back to food and food choices, and one needs to manage. So will fiber help here, doctor? While you add, carbohydrates come karte hai, to will fiber
Yeah.
help?
Fiber, what will it happens? It regulates our peristalsis. It binds with the food. It digested food and help in the clearing of our stool. So many of the patients, once they have a reflux, they have a problem of the lower intestine. They have a constipation. They have a altered bowel habit. They have sometimes constipation with the diarrhea, or sometimes they have a only diarrhea with the bloating. Usually those patients, they do not have a alarming signs. Alarming signs means they do not have a weight loss, they do not have a appetite loss, they do not have a blood in the stools, or bleeding from the mouth. So once these have symptoms of reflux, then constipation, altered bowel habit, bloating, there's the fullness of a stomach, so it is a irritable bowel syndrome. It is most of the time they are associated with each other. Some these GERD symptoms and the IBS symptoms, they are associated with this. So
Well,
fiber
with
helps.
that, I think, yes, with IBS, I would want to point out Vishal's question. Vishal, attentively suniye, doctor is going to talk about IBS, and a lot of other people who have been asking about IBS and acidity or GERD. Here's the topic. IBS से बहुत सारे लोग suffer हो रहे हैं, doctor. A lot of questions there. This is one one topic that everybody wants an answer.
Yeah, no doubt, because every day, I mean, if you talk about a decade earlier or maybe 2 decades earlier, stress factor is less, because now, because of the survival, doing good in a life, every every individual, they have their in mind, we have to succeed, we have to do this. So stress is a major factor, and it comes in every disease. You talk about heart disease, definitely stress is a back, there's a factor, it's a very strong factor. If you're talking about reflux, stress is a factor. In fact, those who are stressed, they go on smoking, they go on tobacco, they go on taking alcohol.
Alcohol.
So yeah, it's a byproduct. So stress again is because IBS is a irritable bowel syndrome, where you will not find any abnormality in a gut. If you do endoscopy, if you do ultrasound, you do CT scan, you'll not find anything. Everything has to be normal. Your hemoglobin is to be okay. So once everything is okay and you keep on having these symptoms, this is called as the IBS, and it's a lot of psychosomatic symptom associated with it, and lot
Right.
of and it is really I mean, for the doctor, it's really difficult to treat, because the stress, until unless you will not manage your stress, it will not be, it will not be cured. So not only with the drugs, you need to have your change in the lifestyle. Whatever gives you stress, you have to avoid it. So I mean, apart from drug, this stress is, you have to be managed.
Done. So somebody was asking about, will depression cause the acid or reflux, GERD, or a GERD, or is GERD causing my anxiety and depression? Is there a link between these two?
It's the same thing, मुर्गी और अंडा वाला जो थ्योरी है कि who comes first, whether the egg or the hen. So it's the same thing. Stress causing GERD or GERD causing stress is comes in a cycle. But I feel the initiating factor of these symptoms is the stress. So stress comes first, and then the symptoms comes later. Until unless you were not taking some drugs, like you taking, you have to take a painkillers because of your pain and the knees or something. Otherwise, most of the things, lifestyle modifications, alcohol, dietary habits. So I mean, most of the things are, stress comes first and these symptoms comes later.
Done. So is it important to manage both different patterns, or is it, what's your treatment advice for that?
I mean, very important. If we're talking, if we patient is having alone GERD, we just ask them, do you sleep properly? Do you, I mean, your anxiety level, do you your जो आपका गुस्सा है, आप ज्यादा तो नहीं करते हैं, या पहले I'll ask their family members also, the papa or mother or the or sister or
Yes.
brother, whosoever, are they started you changing their lifestyle, their day-to-day behavior. So if they are associated with, I mean, the, if only with, if talking about the GERD, uh, they 30-40% they are associated with the stress. They are having, you need to treat them not only with the, I mean, treating the drug for reflux, you need to treat the stress also. The very important symptoms, if you have something called is global sensation, they say it, मुझे यहाँ पे ना लगता है कि कुछ है, ये global sensation, if you have it, so you need, this is a symptoms which suggest you are having some of the form of stress. So it's very important. I mean, I'll take it apart from the interview from the relatives or the patients, the symptomatology.
केस से आप हिस्ट्री पता चल जाता है.
Yeah, ma'am. Yes, of course.
So I think family also plays an important role in identifying
Yeah, of
this.
course,
And
definitely, yes, no doubt about
yeah,
it.
yeah.
I
तो
mean,
यहाँ
stress.
पर मुझे I did not find the registered users question who was asking कि मैं घर में खाना पकाती हूँ तो my husband has a problem with gas, bloating, indigestion. वो बाहर खाना खाते हैं तो उनको सही लगता है. And I've changed lot of oils, and which oil उनको लगता है कि oil से हो रहा है. And a lot of people are asking which oil is good. Will oil cause this hyperacidity?
See, I mean, if you're talking about oil, the important pathophysiology. Pathophysiology is this: what is causing this GERD is the gastric emptying. If you take a fat decreasing your gastric emptying. So if your gastric emptying is slow, your food from stomach to duodenum, the next part of the intestine, it goes slow. What will happen? Most of the time it remains the stomach and causing the reflux. So everything high fat content, whatever it is, oil, it's ghee. I mean, leave apart the type of oil which contains less of a fat, you can take it. I mean, this is not a brand, not a oil means the fat. So try to minimize your oil, rather
Any
the
oil, वो घी
rather
हो या सीड ऑयल
yeah,
हो या
that
नट
contains
हो.
that. Mostly what is happened, refined is the unsaturated fat, and the ghee is the saturated fat. So saturated fat is more harmful vis-a-vis the this refined oil. This is uh, I mean, this is a fact. But apart from the refined, if you talk about, I mean, there are many brands, Afola and all. I mean, they say it's a heart protective or something, but it contains a fat. And the fat delays the gastric emptying, and if delays, then you have a reflux. So try to minimize your oil content, rather to go on which brand or which type of oil you are using. And important is one, many of when I was a child, my father used to ask me to take a glass of milk after the food.
Okay.
So this definitely help in regularize your motion, regularize your stool habits. But important thing is, all the dairy products, including the milk, contains the fat. So it increases the reflux. In terms of reflux, we're talking about, it increases, no doubt about it. But it has milk is definitely a lot of calcium, lot of vitamins. So I'm not saying you not take milk, but if you have a reflux, try to avoid in the night. You better take in a
हाँ.
daytime, rather to after meal, which usually in a practice, this was a practice in my house previously. So uh, you should avoid in a nighttime milk, better you take in a daytime.
Done. So, Doctor, while we were talking previously about IBS, we did not talk about how to deal with it. बोले तो what are the treatment options? You have explained what IBS is. Saikat Nandi is asking this question: how do I manage IBS?
So there is the pathophysiology is a brain gut axis. Brain is a neural pathway. You can't dissect your body, or you can't demonstrate it as this is an axis. So brain gut axis is where you you think that this now is the time to go, and your intestines send a signal to your brain, and you feel there is a place and I can go, and so you can go. So this is a normal happening with every individuals.
Right.
What is happening with the IBS? This brain alteration in the brain gut axis, the signaling pathway is altered. There is some inflammation is going in the intestine. One part of the intestine not pushes the food to the next part, so you'll have a constipation, you have a altered bowel motion. So in that case, there are drugs which we use, and we most of the, I'm talking, if you talk about the reflux, the stress factor is less vis-a-vis the psychosomatic symptoms, is more with the IBS symptoms. So in that case, you definitely need some or other form of antidepressant, or sometimes relaxing drugs. You need most of these patients, they require a nighttime sleeping drug also. So some of the drugs, if I name it, then some anticholinergic, normexin, Bulaspa. I mean, these are the drugs which we are using. Many other drugs also, but definitely you can't go to over counter and you take it, because certain drugs, like I'm talking about normexin, if you have a heart disease, it's an anticholinergic, you should avoid the normexin. So you should not
Acha.
copy
So
it
it's
my
not for
statement.
everybody. So it's for people who require it and under medical supervision.
Yeah, it should not be over the counter.
Correct. So IBS also has to be monitored. Though it is not like it has to be monitored for periods, because I know people who have suffered from 5, 6, 7 years of IBS, and then lifestyle changes have helped them. But it is Have patience is the mantra, Dr. Hitendra.
No,
Would you?
no doubt about it. If we talk about our practice, it's a most difficult patient. The patient they comes with this much of a file. They say I've shown to them, shown to them, but not getting relief because you have to hit on a multiple things. Not only drugs, you have to manage your stress, change your lifestyle. So many you have to work on in many things, and something you have to accept. Like we have examined and I we we label you a IBS only when once your all symptoms are okay. You have no problem in the body. So something you accept it. Once you start accepting, you sooner or later the things will go. Sooner or later the body will accept it. You will start ignoring. Only ignore once you consult with the doctor. The test which your physician or doctor told you about, it should be normal. And once they are normal, so you can sometimes you start ignoring those symptoms, and sometimes you need a treatment. You have this treatment is for a prolonged period. It should not be like 2 weeks, 3 weeks. It should be a for a month.
Yes. Doctor, also talking about relationship between the gastric issues and other health disorders. Gurmeet is having continuous migraines, and is there a relationship between reflux? Sumit is having tonsillitis or उनका upper throat में infections होते हैं. Is there a relationship between acid reflux and these two?
It's very important. The asthma patients, they don't come to us. They go to a respiratory physicians. The asthma patient, and they will prescribe the pump, inhalers or bronchodilator, which dilate your, alveoli so that you will not have the symptoms. This is the pathophysiology. What these inhalers or bronchodilator, it relaxes your lower esophageal sphincter and increases the reflux. So sometimes what will happen? If there are studies out of 100 patients of asthma, the bronchitis, there's the laryngitis, pharyngitis, sore throat, or decaying of, there's erosions of the tooth, and even the headache is also reported. Not a typical migraine. If migraine has been labeled with a neurologist, it's not a typical migraine, but this reflux increases the migraine, no doubt about it. These symptoms will increase, but migraine never caused by acid. Reflux is not been happening. So, but the chest symptoms, 30%, 35%, they are having a GERD symptoms, and it is happening because of them. And you are giving a drug like bronchodilator, which further increase these symptoms, further increase the reflux and increase the symptoms, and you will not
Right.
be getting relief. So, patients, those who are having this asthma, must they must know that they are not having a reflux symptom, because if they are there, so if they are there, must consult a gastroenterologist as well, because these
Ah.
can be
So
happen
it's not just
because of,
one super specialist that they are going to meet regularly in case they have symptoms. They also have to come back to a gastroenterologist.
yeah, yeah, definitely.
Yeah. So, Doctor, while we're talking about medications and long-term usage, a lot of people are asking, ये जो gastric issues के लिए medications लेते हैं, उनके long-term side effects क्या हो सकते हैं? Lot of people are asking. Also, अगर laxatives लेते हैं to manage constipation, I just saw, yes. So,
I'll
अगर
stretch
Alok Kumar.
first, the PPI, which is available over the counter. Most of the patients, they come even for the first time. I will ask, are you taking these? You're taking any drugs? They are taking. I'm taking an omeprazole, pantoprazole, sometimes ranitidine, famotidine. So they are taking the drugs over the counter. So what is the problem is you suppress the acid, where
Correct.
sometimes can lifestyle modification can work, sometimes on and off antacid can work, but you are start taking these the most potent drug to suppress the acid is the uh, uh, proton pump inhibitor called as pantoprazole or the omeprazole. So what it does if you suppress the acid, what it does, there is a decreases the calcium absorption for a long term. Though it is very safe, no doubt about it. But if you keep on taking, So abnormal infections will increase. There's some gut infection. There's reports of the one fatal infection of Clostridium difficile, which happens in the lower part of our intestine. Clostridium difficile. There's a osteopenia. I mean, there's calcium absorption inhibits. So this will cause the inhibition of absorption of the calcium. The patients, those who are having the long term, they can have a headache. So these are not a like a vitamins. You should not take it like it is a vitamin. These are having a side effect, no doubt about it. But of course, majority of time, I mean, still these it's quite a safe drug. But again, they are having with their side effects.
Done.
And
So,
second one is
doctor, yeah,
second,
Dalcoflex, Dalcolax, and
yeah.
constipation
So
के
there
लिए जो
are,
लेते हैं, ये
if anybody has a
सब
constipation, very important, should not take a irritant laxative. Irritant means over the counter we get a clemafin, which contains irritant laxatives. Irritant, what it does, it irritate the gut, stimulate the gut to secrete the water, so it liquefied your stool or digested food products, and you will have a once you lot of water comes into our large intestine, you will pass it, but it will keep on changing. It's a neural. If you continuously you're taking every day, uh, some of the ayurvedic drug patients are taking, this is again is it's
all the
coming
churnas that they take.
yeah, kayam chur, yes.
हाँ,
This is again kayam chur. Most of the patients, they come up with in my OPD, they used to what drug they're taking. They told about this. They are taking the kayam chur. So kayam chur is a irritant laxative, and it will, if you start taking these, the other drug will never work, because this will changes your nerves. The permanent changes in the nerves, and then the rest of the mild laxative like a fiber. If you are having a constipation, start with the fiber. Until unless there's a certain problems which fiber we ask them not to take, obstruction or certain disorder of the gut. uh, so better you take a fiber which is a bulk laxative, which your all your digestive food product is come in a one part, and you they stimulate and then you pass a stool. So better to take it laxative like fibers. Start with this, then you go on a polyethylene glycol is an inert laxative. Avoid these clemafene, Dalcolax, or the Kayam churn, which is a irritant laxative, and use. But it's a potent laxative, no doubt about it. But definitely it causes a permanent changes in the gut.
done. So also people are asking about how safe and what are the side effects of long-term usage of Heptral, and somebody's also asking side effects of Sam. Where did
Same,
I miss? Sampras 20, almost 5 years. तो डॉक्टर्स प्रिस्क्राइब करते होंगे, इतने लॉन्ग टर्म से यूज कर रहे हैं, 5-6 साल से यूज कर रहे हैं. So would you think that this will have an effect on a long run?
Yeah, Sumpras 20 is the same pantoprazole, or it's a proton pump inhibitor. So it increases the gut infections like Clostridium difficile. Also, there's a osteopenia, there's a headache, there's a conduction defects also been noted in the heart with these drugs. So, until unless been prescribed with a doctor, one should not take, because if you are having a significant symptoms, you need to have it. There's no other
Done.
option. So you have to take it, but should be with a, I mean, your physician, your gastroenterologist, in a consultation with your
In
gastroenterologist.
consultation.
Yeah, definitely. And one
Yes.
more, there's a Heptral. Heptral is not a drug for acidity, or it says S-adenosine methionine. It's a Abbott company. It's a multinational company. Abbott makes it. It's a we use it in a liver disorder rather in a gut disorder. And again, every drug has some problem. These drugs should be taken with your hepatologist, gastroenterologist, in consultation with that. And usually the period is 3 to 6 months. But
Yeah.
in a liver disorder, not in IBS, not in reflux, not in acidity, it has no role in that.
Right. So, Johnny, I think you got your answer there. And Subhashish Saha, yes, we've been answering that question well. So, there are a few questions about atrophic pancreatitis, and also somebody has chronic pancreatitis. Pratik Tiwari says, Sir, I'm suffering from atrophic pancreatitis. What iska ilaj kya hai?
Usually atrophic means your the parenchyma get atrophied, means shrunken, and is finished off. It comes under the heading of chronic pancreatitis. Your pancreatic parenchyma gone. So in the etiology, most common etiology, 90% of these patients of chronic pancreatitis have a alcohol abuse.
Ah,
So
okay.
90% of chronic pancreatitis is the etiology is the alcohol. Other are there, some are drug induced, there some are autoimmune, some are because of your lipid profile, so abnormality, triglyceride abnormality, but majority is the alcohol. So in that case, if you don't have, you are not having symptoms, the most common symptoms you are having is the pain abdomen. So pain abdomen mimic like there's the acidity, but it is the pain is more severe, radiating to back. There's a calcium deposition in the our pancreas. You have a diabetes, you have a pain, you have a because pancreas will help in secrete enzymes will digest the fat. So you will pass a fat in the your stool. So greasy stool you can have, and malabsorption, so you are becoming weak, diabetes, pain, and definitely fat soluble vitamins, you all been lacking in that. So treatment according to, if you have there is a stone in the pancreatic duct, you need to place a stent to prevent the pain. So I mean, depending upon the symptoms, if you're not having symptoms, you can't do that. Better you avoid the factors which can cause this atrophic pancreatitis. So in that case, if you are having alcohol, just please avoid it. You don't take it. Avoid smoking, avoid tobacco, avoid alcohol. Take vitamins. There are drugs like enzyme replacement, pancreatic enzyme separate. You can take that. On and off painkiller you might need. You can take that. So depending upon the symptoms, there are treatments.
Done. Doctor, here's a question about. Uh, Sorry. My mother's undergone a gallbladder surgery. She's now having gastric issues. Her stomach bloats all the time. What may be the solution? Abhinav Gaur is asking.
What the function of a gallbladder is excess storage of a bile
Bye.
which produced in our liver. uh, Normally in a day we produce around 500 ml of bile, but we require only 100 ml. This is for every individual, unless we'll take a lot of fatty food. The bile has enzymes which digest the our fats. So once you take a excess of fat, the gallbladder secrete that bile, comes in our duodenum, help in digestion of fat, and this is the only function to storage of excess bile. Once you remove the gallbladder, this bile duct, which is in connection with the gallbladder, start having this enzymes, uh, this bile, they start accumulating this bile, so that after the surgery you can see there's a dilatation of the bile duct. So it is normal happening, and sometimes this once you have it, sometimes these patients they have a they have a bile reflux. So these patients, some of the time, initial part of after the surgery, they have this because of the fat decrease in the fat absorption, digestion basically. So initially they have it, but later on, once this bile duct accumulating the extra bile, these symptoms will go.
Done. So, Ankahi Bate, he also had gallbladder surgery in 2020. Now I have a serious issue of indigestion and gas. My age is 30. So, after, and in case there's a removal, and how do they manage this?
Again, if you have a symptoms like reflux, because initially part you can have a bloating, I told you, because of it helps in the excess storage of bile. Once you remove it, the fat. It's for a temporary. It's not for a long duration. But if you had a symptoms like IBS and symptoms like reflux, then you need to definitely consult, and you need a treatment like similar as the reflux or the IBS.
Okay. Okay. So somebody, I'm still trying to look out for that message. इतने messages में वो गायब हो गया है. Somebody feels that they're यहाँ अटका हुआ है. And what do I do? So आपने I immediately related to the earlier question answer that you gave. तो जरा उनके बारे में बताते रहिए. I'll figure out the.
Called as the global sensation.
Maddie. Sorry, doctor. I got the question back. I was diagnosed with LPR 15 days back. I always have a feeling of something in my throat. Past 1.5 months, especially while swallowing saliva, there is discomfort.
So this is what is happening. You are diagnosed as a reflux disease. He told reflux. What is told?
LPR.
I think it's related to reflux only.
I'm not sure. But doctor, yeah, but he always has something of a feeling of throat in the past one.
If you diagnose as a reflux disease, the normally I told you it's a normal process. Reflux is a normal process. It's happening. It's happening in every individual. What will help is our saliva or our tertiary contraction in the esophagus. What it does, it dilute the acid which comes during the reflux, and our tertiary contraction of the esophagus which propels the acid into the stomach. This is happening, and again the our lower esophageal sphincter which got tightened up, the again acid will not come. So this is happening in every individual. It's a normal process. Once this relaxes, the acid will come up, and this is an abnormal increase or excessive reflux of the stomach content in the esophagus. And patients, those who are having the reflux, they have a weakening or less tertiary, the contraction which is happening in the lower part of the esophagus, which is weak, now become weak, and they are having the prolonged exposure of the acid in their esophagus. They have a symptoms, and once sometimes this acid will come up, they have some sensation. There's a fullness, there's something is here. So it's called as the global sensation, and you need a little sometimes you need a apart from the proton pump or the prokinetics, you need some I used to give some clonotils kind of a thing. 0.25 is small, or alprazolam kind of for a transient duration, which help in decreasing this sensation, global sensation.
Done. So, doctor, I will have to wrap up. So, before we go, I would want you to give me tips to manage GERD. While a lot of people are saying that उनको कोई other endoscopy में कुछ और पता ही नहीं चला है, normal endoscopies है, normal reports है, और उनको lifestyle manage करना ही है, और they have been doing non-oily, non-spicy food खाते हैं, फिर भी उनको होता है, तो वो कैसे manage करें?
Important, very important. We call it GERD. Is another term is the NERD, non-esophageal reflux disease. You have a symptoms, but you don't have a hiatus hernia. You don't have a weakening of lower esophageal sphincter. So everything is okay. And if you do the endoscopy is normal. So it called as a NERD. NERD is all. You need the patient, those who are having these symptoms, you have to the test is the 24-hour pH manometry. In that case, the weak acid or the bile reflux. Bile is alkaline, acid is the pH is low, bile is alkaline, the pH is more than 7. So this 24-hour pH manometry, what it differentiate, you are having a acid reflux or you are having a alkaline or the bile reflux. If you are giving a treatment for acid in a bile reflux, it will not respond. So in that case, you need to have to understand what I'm having, which is you are taking a drug for
the reason for it.
Reason of it. So NERD patient, they are not having these, but they are having the symptoms. So in that cases, we need to have it. We need to know whether we are having a bile reflux or weak acid reflux or the bile reflux. or the acid reflux. In that case, this 24-hour pH manometry will suggest you this is a catheter, small catheter will go through nose, will stay here. There's a pH sensitive. Once you are having a symptoms, and we correlate it after once these having the things will happen once you are having a symptoms, and there's a monitor, you just click on it, and then I'll check it on it. Once you are having a symptom, what was the pH? If you are having a low pH like acid, then definitely it will help. It will help, and it will, you need to combine it with the prokinetic because of the weakening of this tertiary contraction of the esophagus. Prokinetic will help in clearing the acid content from esophagus to the stomach. So
And
apart from proton pump blocker, you need to have a prokinetic stance. Decrease your food habits to not in a go in a one in a gulp. Like, you have to divide your food habits in a three. I used to say three times you used to take it. You suppose you need to take it 5 times a day. You decrease your elevate while you're sleeping. You just elevate 10 degree, 10 or 15
yes,
degree.
doctor, before you give me those top tips, I would want to interrupt you. One important question that I think I've missed. Anjali Thakur is asking, Jhansi, please ask my question. My hubby has liver cirrhosis. His stomach is always bloated. We have consulted liver specialist, but no result. So quickly tell me, doctor, when is the time that they need to consult a transplant hepatology
Definitely.
specialist?
See, I am basically I'm working as a transplant hepatologist here. Once you have a ascites, once you have alteration in the mentation, you went into encephalopathy or went into coma kind of a thing, and there is a involvement of the kidney. So, and there's a history of you are having ascites and you are having a bleeding. This is all the symptoms of uh, liver disease. So there are two scores, child score or the mild score. Once you consult your hepatologist, they make it. Every patient of liver disease, just we there's a every hepatologist will make on your give the tell you about the score. If the child score is more than 7, that is 8, depending upon this, based on the ascites, based on your PTINR, bilirubin, there is your mentation, there is ascites. So based on these 5 parameters, the child score we used to calculate, and if it's more than 7 or 8, we prescribed it. Child C, no doubt about it, you need a liver transplant. 8 or 9, late late B means 8 or 9, we prescribe for a liver transplant. And second, another score is more specific to it, is the MELD score, MELD sodium score. MELD score based is a computer based on creatinine, your kidney parameter, liver parameter, bilirubin, and INR. And based on if your child score, MELD score is more than 15, we suggest to think about
So
start.
yes, so
Yeah.
Anjali, I think you should consult Dr. Hitendra Garg over Apollo 24/7 platform, where he'll be able to guide you further with all the other score. Thank you, Dr. Hitendra. I'll have to wrap up here because I'm running short of time. So top tips, top 3 tips to beat and manage acidity or acid reflux from you, doctor.
So most important, if we talk about the how to manage, then it's most important. You lifestyle is modification is very important. You must stop smoking, must stop alcohol, must stop your tobacco. Taking good balanced diet means you should not be taking a carbonated drinks, not spicy food. You don't do this. Control your weight. You should control your obesity. Your BMI should be between the 20-24. Exercise is definitely is important. Reduce your stress. So these are the things, the lifestyle modification, apart from the drugs which you take, it pantoprazole or prokinetics. These are the things which help in managing your reflux. So this is if you do this 9, because you can't continue keep on taking the drugs. So these lifestyle modification is very important. You do it.
Done. Thank you so much, doctor. I understand that the time is very less and a lot of people have been asking too many questions, but I appreciate your patience and the kind of in detailed explanation that you have given. Thank you, Dr. Hitendra.
Thank you. Thank you, ma'am.
Thank you. Thank you. So let's move on quickly to our quiz. Here are 3 questions coming up. Please answer only on YouTube chat. Winner's name will be announced towards the end of the show at the sole discretion of Apollo 24/7 team. And if you are declared a winner, you need to write back with your contact details to us at marketing@apollo247.com. Gift vouchers will be shared with you. All right, now to the questions for today. Health quiz coming up. Questions on your screen. Here, question number 1. What is the full form of GERD? GERD. आज तो बहुत डिस्कस किया है इसके बारे में. GERD का full form टाइप कीजिए, GERD का. And question number 2. Who would you consult for advanced liver disease and liver transplants? Who would you consult for your advanced liver disease and liver transplant? Which specialist is our question. So नाम मत लिखिएगा, उनका speciality लिखिएगा please. Super speciality, yes. Question number 3. How much cashback does Circle membership give on the order value? If you are a Circle member on Apollo 24/7, you would definitely be knowing the answer. How much cashback does the Circle membership on Apollo 24/7 app give you on the order value? If you know the answer, please type. If you don't know the answer, open your Apollo 24/7 app and check how much are you getting back. All right. So I'm waiting for your answers. In the meanwhile, let me give you away these coupons which you can use on Apollo 24/7 platform. The first one is 150 rupees off you get if you use the code FIRSTVC on the first online consultation, doctor consultation, which is on Apollo 24/7. The code that you need to use is FIRSTVC. All right, get 150 rupees off there. And the other coupon that we are giving away today is code FIRST3, FIRST numeral 3. Get flat 25% off on online medicine orders. Order medicines on Apollo 24/7. Get medicines direct from Apollo with flat 25% off on your online medicine orders. So the code you need to use is FIRST3. Also, exclusively, thank you all for joining us on today's Health Hour. So Health Hour viewers, you get this exclusive coupon from us. Use code HH247 and you get up to 199 rupees off on online consultation with Apollo doctors. And also you can use this exclusive code to get up to 20% off on medicine orders. This is in addition to the other coupons that we have given away. So it's wonderful. Please download Apollo 24/7 app to use these coupons there. And while I'm waiting for the results, while our team is picking up winners for this week, I'll tell you next week we have a very interesting topic which will be useful again to most of us. We're talking about frequent headaches and what could be the causes. It could be anything you want to ask about headache. Please join us on 10th July, 11 a.m. And this is a very, very important and a very common topic that we recurrently talk about. So if in case you don't want to miss this, do subscribe to Apollo 24/7 on YouTube. Also do follow us on all the social media handles where you'll not miss out any important discussions or tips that we share out there. And also you can ring the bell, you can tap the bell icon there where you get all your notifications on YouTube as well. Well, here are the winners, by the way. The winners for today are Anmol Ratan Singh, Brigadier Larson and Sandhya Suresh. Anmol Ratan Singh, Larson and Sandhya Suresh, please write back to us to claim your gift vouchers. You need to write back to us at marketing@apollo247.com with your details. Well, thank you all of you for joining us. It was a great session. Looking at your participation, it was really wonderful. So see you next week. Namaste.